Hi, I'm Dr. Rob Silverman, Amazon best-selling author, Inside Out Health, A Revolutionary Approach to Your Body, and ACA Sports Council Chiropractor of the Year 2015. I've got 20 years of clinical experience dealing with over 10,000 patients. And one of the biggest things that patients come in with, that they say they do, that's really wrong, is doing sit-ups. Sit-ups are a no-go. Don't do sit-ups. Now, the reason you don't want to do sit-ups, let me explain to you why. Number one, a sit-up is a lot of motion in the abdominal spine. You do not strengthen your core and your abdominals by actual motion. Your core is a true brake to movement. But let's get to the sit-up. Here's somebody in a sit-up position and they bend. So when they bend, they're actually putting pressure on their disc material. They're not protecting their disc material, they're bending their disc material. By bending your disc material, you're damaging your discs. In addition, you're using your iliopsoas right over here. Your psoas and your iliacus, your iliopsoas. When your iliopsoas is tight, it puts pressure on your lumbar spine. It causes you to be in what we call anterior pelvic tilt, and leads you down a path to damaging your disc in your lower back. You're only allowed 28,000 bends or flexion in your whole life before you herniate a disc. So you don't want to do them while you exercise. If anything, you want your exercise to be protective. So no sit-ups, please. No more sit-ups. Avoid crunches, because crunches really are causing your neck to move too much in flexion and not isolating your abdominals. So what is your answer, or what would be my answer to a sit-up for you? I like planks. I like front planks, I like side planks, and I like bird dogs. For today, we're just going to talk about the front plank. The key element to a front plank is a proper brace. A brace is a 360-degree co-contraction to hold your spine in an appropriate place. That's a brace. Once you're in a brace, a front plank where you're holding yourself on your forearms and you feel your stomach, your abdomen area really contracting really hard is an excellent move to engage that intrinsic musculature to hold your spine in a place. Just remember, your core is not for movement. It's actually the brakes. They don't want you to move. Your movement's going to come from what we call your periphery, your arms and your legs, and especially your hips. So if you see somebody doing a lot of sit-ups, a lot of crunches, it's bad for them. They're going to have to come see me with 20 years of experience. Now, these are the type of things that I go over with people when they come in with a lower back injury. 80% of Americans have a lower back injury. So a lot of people come in to see me for lower back. We specialize in a lot of lower back injuries. So if you've got a lower back injury, one of the things I'm going to look at is what you did to get there. So when you get treated and fixed, if you will, you're not going to do those daily movements to re-injure yourself. That's a critical element to what a good chiropractor can do. That's what we do here. We do a full assessment. We do a full treatment with a multitude of modalities. As you watch my YouTube channel, please like, share, and subscribe. I'll say it again, like, share, and subscribe. Stephanie made sure that I learned that. Like, share, and subscribe so you can share all this good information. If you have any information that you want me to talk about, feel free to put it in the comment box. We will address it. We're going to try and do several a week. What you do when you come in, or what you receive when you come in, is you get a full assessment, you get a treatment protocol, you get things that you need to do to avoid, and we talk all about nutrition here. We're a fully fledged facility. So, like I said before, the information will be in the description box below. Like, share, and subscribe. Dr. Rob, always yours in health, no sit-ups.